will not work that way.
Okay, let's narrow this down to Zimap. At least we have heard of, it being administered on the Spanish priest who sadly, died, the 2 Americans, and of course the Liberian doctors, one of whom, passed on.
Yes.
Going by what we have, and you want to take just a stand and say, okay, is Zipmap working? Is it not working?
Well, it is too early to say whether Zimap is working or is not working, because if you look at as far as we know, the information we have is that 4 people had taken, 4 people that were affected with Ebola virus disease had taken or were given the Zimap.
That's like 6 of them now. 3 Liberians, 2 Americans, and the Spanish priest.
Well, okay, fine. That's 6 of them, and I'm aware that 2 have died, right? That means 4 are alive. Is that correct?
2 have gone home.
Yes, 2 have gone.
Been treated.
Yes, so 1 we know that 2 the priest had died, the Liberian doctor had died, and 2 have been discharged. Is that correct? Now let's extrapolate it to Nigeria. We had 13 cases, right? Of the 13 cases, 5 had died. If you look at the management of Ebola virus disease, would you then say that if you don't give Zimap, you are offending the protocol? From our own result in Nigeria, I think the aggressive nature of the management replace it as much as possible, and then of course monitoring the electrolytes, ensuring that there are no new infections, and monitoring the kidneys, the liver, and the liver enzymes, and the kidney functions, and of course give oxygen as appropriate and transfuse blood as appropriate. I think that's an aggressive approach to the management. So by and large, the Nigerian example probably would mean that we need to look at Zimap again. Again, it's an experimental drug. And like I said, if you are drowning and you can get hold of any stick or any rope, you can hold on to it, right? But we probably have shown, maybe it's too early to say, but we have shown that we do not necessarily have to use Zimap for people to survive.
Now, those that have been discharged, I understand that even Zimap, there was something they had to take from people who survived Ebola, previously, and I don't know, you're a scientist, you know how you take note of these immunological issues. Are you going to be working with those that have been discharged, who perhaps, as I understand, they now have immunity against Ebola?
Well, it's a possible option because they would have developed some level of immunity to this, but we need to prepare the protocol and see. First of all, it is their right to decide whether we should work with them or not. If they refuse, you can't force them. But I'm sure that they would want others, to leave if they have Ebola virus disease, just like God has saved them through the efforts of the health practitioners. So, in my opinion, I think that is an acceptable option, but it's not something that we can right now just discuss because it must go through the processes.
Thank you so much for your time.
Thank you. Thank you very much.
Thank you.
Thank you.
Still on Ebola containment, the Lagos State Commissioner for Health, Dr. Jide Idris, said aside from infection prevention, management and control, another challenge the health authorities have been contending with is the issue of misinformation.
A critical and pervading challenge is the issue of rumors and false stories being disseminated, especially via the social media. These continue to create unnecessary and unavoidable anxiety and worries within the polity. They have the capacity to undermine the efforts being made to contain and manage this outbreak, as those who ought to present themselves for treatment may get discouraged. Malign government in the face of residents and first stigmatization of individuals and businesses. Let me explain again, because yesterday, read on the social media on one of these units that one of the cases that we had in isolation tested positive, which was totally false. And that created a lot of alarm. We received phone calls, text messages, even from the US and within Nigeria here. And that's why I say that this one, it can create unnecessary anxiety. And also it can negatively affect these same people because people will start running away from them. And that's why I felt it necessary to bring it to your notice. In addition, rejection of federal patients, I mean patients who present with fever in our hospitals, without prior assessment constitutes another challenge. As same may also increase stigma and deter self-reporting. Not everybody with a fever or hemorrhage has come down with Ebola viral disease. A situation where these cases are automatically referred to the mainland general hospital is not good practice. I appeal to our colleagues in the health sector, both in the public and private, to commence the management of these cases using universal safety precautions and only refer them if there is an indication so to do.
Meanwhile, the federal government has condemned the stigmatization of Nigerians by some countries over recent cases of the Ebola virus disease in the country. At a meeting with the special envoy of the United Nations Secretary General, Mr. David Nabarro, President Goodluck Jonathan particularly denounced discriminatory actions such as that which forced Nigeria's team to the Youth Olympics in China to abandon its participation. He urged the UN Secretary General, Mr. Ban Ki-moon, to support the call for the cessation of discriminatory actions against Nigeria. Mr. Nabarro, who had visited Liberia, Guinea and Sierra Leone, the countries worst hit by Ebola, before coming to Nigeria, said he had come on the instruction of the UN Secretary General to applaud Nigeria's successful containment of the virus.
The point I made to the President of Nigeria is that this country and its people have performed excellently in their response to Ebola virus disease. It's been a whole-of-country effort. All of society has been involved, and the correct procedures have been adopted. There will always be outbreaks of dangerous diseases in our world because of globalization, because we want freedom of movement between countries and between communities, and because there are viruses that move from the animal kingdom to the human population, and they sometimes can spread between people. But we also know that good public health techniques and the full involvement of all of society, strong leadership by all, whatever their political party, can lead to successful control efforts. We, of course, regret that some people lose their lives, but isn't it extraordinary that if it's done well, the lives lost are very few, and the communities are able to survive and continue their normal lives. There may still be some people who get sick and die as a result of this current Ebola insertion into Nigeria. But I'm confident that the government and the people will be able to respond in the proper way and to ensure that the situation is kept under control in a way that pays full attention to people's rights and entitlements.
On the global scene, the World Health Organization's records show that an unprecedented number of doctors and nurses have been infected with the Ebola virus in West Africa. Over 240 healthcare workers are among the more than 2,600 people infected with Ebola in Guinea, Liberia, Sierra Leone, and Nigeria since March this year. The health body says infections in medical workers are due to a shortage of protective equipment and staff. Only 1 or 2 doctors are available for 100,000 patients in some countries. The WHO said the heavy toll on healthcare workers had consequences that further impede control efforts, such as the closure of health facilities. With severe shortages of doctors and nurses in some countries, many are working beyond their physical limits. Past outbreaks have been brought under control fairly rapidly, once the virus was identified and protective measures put in place. The current outbreak, which is the largest ever, has overwhelmed struggling health systems in some of the world's poorest countries. I won't forget to mention that medical doctors in Nigeria are now fully back at work after 55 days of strike. Although they've suspended industrial action, the NMA says government is yet to meet the doctors' demands, a claim government officials say is not entirely correct. Negotiations are expected to continue. It's now left for both parties to find a lasting solution in the interest of members of the public. As we wrap up the program, Nigeria may be on her way to total containment of the Ebola virus. But this is not to say that the government and indeed the people should let down the guards. We all should remember our hand hygiene, avoid the risk factors, look out for the symptoms of Ebola, and report any suspected case by calling 0800 Ebola Help. Thank you for watching. I am Yomi Otaiwe.